Good morning. My name is Paul Leong. I'm in a private practice in Pittsburgh, Pennsylvania. I want to thank the meeting organizers for granting me the opportunity to speak. I'm going to give a presentation that's a review of some of the sort of basic characteristics of microcannulas. For those of you who've been at the meeting the whole time, you've heard a little bit about this before. But I kind of wanted little comments at the end of my presentation and make some comments about some of the emerging positions I've heard in terms of how comprehensive our consent process ought to be or needs to be. And I certainly have some opinions about that. So in terms of the disclaimer, I do not receive any compensation from anybody. Presentation content is fairly standard. I'm going to talk about the advantages of microcannulas, potential disadvantages when you adopt these into your practice. I'll briefly review some of the types of microcannulas, talk a little bit about technique, go on to some examples of my work, and then draw some conclusions, as I mentioned. So the concept is fairly simple. We've all injected various filler materials, whether it's HAs or radias or even Sculptra, with sharp hypodermic needles for many years. And, you know, it's a logical place to start. It's what we're all used to, when we went to our training. But the notion is to replace hypodermic needles with cannulas. These are very small, very fine cannulas. They come in different gauges, but they're all pretty fine. And the tip, of course, is not a sharp point. It's a blunt tip, it's a rounded tip, and therefore necessarily the hole, the aperture from which the filler emerges is not at the absolute distal aspect of the cannula. It's a little bit receded from that. And so those characteristics, in general, less rigid, though the different brands have different levels of underlying rigidity, the blunt tip and the flexibility. The fact that the filler comes out a little bit proximal to the tip. These are the injection characteristics that the clinician needs to become accustomed to. So advantages, and again, this has been discussed a little bit. Bruising in my hands. Let me speak about my experience. It's absolutely unambiguous. It's very significantly reduced. Even in the hands of absolutely expert injectors, of course, you can get bruising with needles or without. We had a nice lady who volunteered for a procedure earlier this meeting, and she has a little bit of a bruise, not too bad. Swelling, this is, I'd say, a bit more controversial. In my hands, I think it seems to be a little reduced as opposed to increased when you use microcannulas versus hypodermic needles. And certainly, if you get any element of bruising, enhanced bruising, with a hypodermic needle, I think the swelling is also reduced. Though you'll hear the counter opinion sometimes. I think the comfort level. Now I use a very specific technique. Not everybody, I know people who do wonderful work with cannulas who go through this. But I go and I put a little, just tiny droplets of local anesthetic, standard, 1% lidocaine, with 1 to 100,000 epinephrine, and then I wait for 4 or 5 minutes. And therefore, the kind of bruising that one might experience deeper down, hopefully is handled by the blunt tip cannula, but that dermal bruising that you can get as you push the microcannula in and out of the skin through the port, I think this local anesthesia with the obvious blanching that occurs after 4 to 5 minutes is improved as well. Excuse me. I think in general, most people who use microcannulas tend to use less pokes than the needle, therefore perhaps it's a little more comfortable. And then I think the procedures, I will concede, they can take longer, especially initially, because there's a bit of a learning curve, just like anything technical. But then again, if you get any bleeding points, or more so with hypodermic needles, I think the procedures perhaps the same time or maybe even a little shorter on average over, say, 50 patients. Now, in terms of advantages, microcannula use, we've heard a little bit about the Tyndall effect, including in the most recent presentation. My sense of it is simply this. The microcannula is poorly adapted to be injecting dermally. Dr. Moss made some nice comments about, well, why are we really even calling these dermal fillers if that's not where we are most of the time? Well, it's pretty simple. It's a blunt tip cannula. Try pushing that through a thick and sturdy and robust dermis. It's not too easy. It, by its nature, slides into the area a little bit deeper than that, and therefore it almost forces your hand in keeping it from being too superficial. And therefore, I think the temple effect, you have a little bit of a protective mechanism there. And the exact same logic applies to nodules with Sculptra. There's different reasons you can get nodules with Sculptra. I'm not saying this is, and now it'll never happen. But again, if you're injecting Sculptra, and of course if you've done it or you've seen me do it, there's a lot of passes. And we're all wonderful technicians, but only if you're absolutely perfect, which nobody is, are you not going to be the needle just slightly within the skin where you're continuing to inject Sculptra. And I think you'd be at a greater chance for developing nodules in that circumstance. So again, if your cannula forces you to be in a somewhat deeper plane, all the better. Reduced intravascular complications, and so this is the biggie. In my view, I think patients like it because bruising is diminished, and not by 50%, it's more by 6 or 7 times, okay, in my hands. They like it because the way I do it, they perceive it to be a little bit more comfortable. And I think because I'm a little less angsty about getting bruising, I sort of am able to loiter a bit more and go into areas that I think, but that area's a little vast, or I always get a bit of bruising. I'm much less concerned about that, and therefore I think the end result in my hands is better. That may not be the case for everybody. But the real reason I like it is because in my own mind, and I heard a wonderful panel up here a few days ago debating, there seems to be good evidence and indeed published evidence that the bruising is less, but evidence in terms of intravascular events is only emerging. Just anecdotally speaking to some of the people individually in the panel, they said it's hardly emerging, it's pretty clear. The people who are compiling this data is pretty clear. It's less. So I think that's enormously attractive to me. This is just some published literature. Conclusion, using blood-tip microcannulas as an alternative to the hypodermic needles has simplified filler injections, produce less bruising, ecchymosis, and pain, and faster recovery. This is simply highlighting what Corey mentioned just a minute ago. This is the Korean literature, concentrated filler injections to the glabella region or the nasolabial fold. You don't need to be up near the eye. Can cause retinal artery occlusion. Pancreatic ophthalmic artery occlusion is associated with painful blindness. And this is again from the Korean literature. So it certainly can happen with hypodermic needles. That piece of Korean literature is not common to have microcannulas. Now, disadvantages of microcannula use. Well, there's a little bit of an incremental increased cost, which I think is irrelevant in terms of good care for your patient. And I mean, if your patients are happier, we all understand. If your patients are happier, it's good for everybody. There's a learning curve. This flexibility business. Some people like that flexibility. Others are like, I mean, surely it's better to have a linear determination or approximation of where the tip of your needle is. If this thing's squiggling around, well, you can make your own determination.